Hi, my name is Dr. Sean Nikravan, endocrinology, metabolism, and internal medicine. The topic of diabetes is a vast, large topic. Therefore, you must first identify what type of diabetes you have. Is it a type 1 diabetes, which is an autoimmune disease, which typically happens in the younger age, or it can happen later in life, which also can be considered as late onset autoimmune diabetes of adult. It's called LADA, versus type 2 diabetes, which is more of a phenotype characteristics of an elderly who has type 2 diabetes based on lifestyle changes or obesity. Not necessarily you have to be obese to have type 2 diabetes. The other aspect of diabetes could be gestational diabetes, which happens during pregnancy. So therefore, we must first ask the question, what type of diabetes we have. And once we stratify the type of diabetes we have, then we can classify how to treat the diabetes. Therefore, there are many treatment plans available for type 1 versus type 2 diabetes. Type 1 diabetes typically is managed all the time with insulin, and the insulin we manage those patients are usually insulin which is rapid acting and long acting, or we manage these patients with an insulin pump. In type 2 diabetes, we manage patients with multiple pharmacotherapies by addressing their core defect. We look at many pathways because we understand that managing diabetes requires the full understanding of how the pancreas is functioning, how the fat metabolism is, how the liver is, how the kidney versus the brain versus the muscle versus the pancreas. So these are very important topics we ask ourselves, and every therapy available that we have at this point in time, we focus that specifically. We love to use therapies that cause weight loss. We love to avoid therapies that do not increase the longevity of the pancreas. So therefore, we partner up with the patient by applying continuous glucose monitors, if necessary, by truly understanding where their defect is. This is very important because not one therapy fits all patients, and not all patients can handle a certain therapy, even though it may be the gold standard therapy. So the individualization of the therapy is the most important way we deal with our patients. For further information, please feel free to reach our office for the recommendations. Thank you.